time off work and ability to do all the things we needed to do between travel and appointments and surgery and leave after surgery. And we have both had amazing support from both of our offices. That, you know, while we do have FMLA, it was never a fear that our jobs would kind of balk at any of this. They both have really been understanding, and I've just kind of said, you do what you need to do. We're both pretty judicious. I mean, we're both pretty judicious with keeping an eye on our PTO time. So you know, for me, I've been able to, you know, Allie's been able to go on some short-term disability after her surgeries. So from that financial aspect, that's provided a little bit. But then with my PTO, I've just been able to really kind of manage that in other time periods so I can use it when I need it then. But, you know, the other aspect of that is we've kind of gotten used to this whole surgery aspect thing, unfortunately. So we've kind of discovered how much care and assistance Allie needs after surgery. So for me, I've actually, the last couple of times, I've actually been able to get back to work, at least on a part-time basis, pretty quickly. So I actually, after her most recent one, I was home for a couple of days, and then we had a lot of help from family, and then I would go into work in the mornings, and then I would be home in the afternoons. So I didn't have to use quite as much leave from work in those periods. It's become a little bit more complicated as we throw in traveling up to the NIH over the last year. And that's required a lot of communication with our offices, a lot of communication with the NIH. You know, we're not the only ones that travel to NIH, but a lot of patients there are local from if I can speak, from the Bethesda or Washington, D.C. area. So it's not as difficult for those patients, but for us, flying halfway across the country, it really is. So trying to just figure out with them how we can best get our scans done and get the appointment done kind of as quickly as possible and as condensed as possible so we can get in and out. There was one time where we flew in and out of Bethesda all on the same day, just so we only had to take one day off work. So we've been forced to be a little bit strategic about how we plan out some of that stuff. So that's definitely changed things a little bit.